Welcome to the Discovery Doc podcast. I'm here with your host,
Dr. Cece, functional medicine nurse practitioner, crunchy mama of 3, and self-proclaimed toxin tamer. And this chick over here,
I'm Anna Kate, your medical mystery overachiever and discovery liaison. And I'm going to add something to my title this time. I'm an antibody accumulator. So if you've got extra antibodies out there, I'm your girl. You're my person. So today we've got a very special guest with us, and I'm going to let Dr. Cece tell you more about her.
Yes, we have Dr. Arlene Dijamco, a passionate and integrative physician. She is a cranial osteopath, a mama of 4, and someone who works to bridge mental, emotional, and spiritual aspects of health back into medicine. She is also someone that I refer quite a bit of patients to for her expertise. Dr. Dijamco, thank you so much for joining us. We are so excited to have you today. If you would please take the floor and talk to us about just your background, your education, ultimately what led you to becoming this amazing multidimensional MD.
Oh, I'm so happy to be here. Thank you, everyone. Well, it started in medical school. I went to medical school at Emory, and my first year of medical school, I had this epiphany. I was like, we're looking at it all wrong. What if instead of comparing everything to the placebo effect, we studied what the placebo effect was and harnessed it and figured out what that innate capacity of the body to get better from within was, and then use that, and then we wouldn't have to worry about the side effects. So we were in this group discussion with my friends and colleagues, other medical students, and the attending physician there, and I raised my hand and I said that, and I thought, this is going to change medicine. This is going to change everything. This is common sense, and I don't know why no one's looked at it like this before. And I thought at the very least we were going to have this great conversation of like, wow, that's a great idea. But, they just looked at me kind of funny. And then the attending physician said, well, that's an interesting way of looking at it. And I looked at my friends and they were looking at the attending physician. And, these were brilliant people. They had studied so hard. And I was like, why are they looking at the physician? Because this is not like a right or wrong question. This is more like a philosophical thing, like a discussion of like looking how we can help people. And then that was it. We never had any discussion about it. So it just left me thinking like, there must be something different about me, but I'm not sure why, because this is so clear and such common sense. Like they didn't feel like I had to think really hard to come up with it. And but just like going on through my medical training, there were certain things that happened to me that really made a big impression on me. So that was one. And I just kind of laid back in the back of me, like I will pursue this. I will figure out what that is over time. But I kind of laid low because everyone was like, they weren't as curious about it as I was. And then when we started
become judgmental too.
Yeah, absolutely. And then when we started the clinical rotation, so this is when we go into the hospitals, and we were at Grady, so that's in the city. And I don't know if people know, but like Grady used to be segregated a long time ago. It's shaped like an H, and it used to be segregated. So just to give you a little bit of a history. So anyway, there was a woman there, and she was there for pneumonia, and we had learned how to do a perfect history. So you ask all these questions, it's pages long. And so this was my first patient interview. So I asked her all the questions I had on my page. And one of them was, have you ever had any trauma, any sexual abuse or any other trauma? And she said, yes. And I looked at the next question on my list, and it says, have you ever told anyone? And she said, no. And then I looked at my page, and I'm looking for like the diagram of like, if yes, if no, do this. And there was nothing. And I was really green and young, and I didn't know what to do. I didn't know how to respond. And then I looked at the attending physician. She said this in front of the whole rounding team. So these other medical students are there. Everyone's just blinking at me. Nobody's making eye contact. And I'm like pleading at them, like, help me, like with my eyes. No one said anything. So I just kept going, and I felt terrible because why would you ask such a question? And then she just had the courage to answer it. And then we acted like it wasn't even important.
Wow.
We didn't care that it happened to her. I was like, the act of even asking the question and not even like addressing it is harm. It's creating harm.
Yeah.
So I thought, okay, so I had an ethics class later that day and I thought, okay, I'm going to figure out what to do. They'll know what to do. And so they said, oh, that's a great question, Arlene. Thank you so much for bringing that up. And I'm thinking, she's still in the hospital. We got time. We can figure
Right.
this
You can
out.
go back and make this happen.
Yeah. And it was just, oh, let's just talk about this. Oh, isn't that so ideal? And I'm looking for the practical, like, well, what are we going to do? And there was nothing. So I was really angry.
Yeah.
And so, like, right then and there, I was like, I will never be this kind of physician. And if they aren't going to teach me how to address things like this, then I'm going to figure it out, because no one had taught me, but I knew the person in front of me was a human being.
Yeah.
And that health involved all of those dimensions. She wasn't just a body. She wasn't just like this physical thing in front of us. She was a human being. And at the very least, we could have shown her some compassion and presence. And, going back, even if you didn't know what to do, I would have just said, I don't know what to do about that right now. But
Right.
if you would like help, like we'll figure it out.
Without
We'll figure out what
together.
we can do,
Yeah. Absolutely.
something. And then, that leads into like just like going on and on into residency and even just like talking about pneumonia. Like, well, why would you even ask such a thing? Like, what would that have anything to do with pneumonia?
Did
Um,
you find yourself, once you got into residency, did you find yourself having a hard time sometimes clinically to manage patients or get through your day? Did you feel like restrictions were put on you or boundaries were put on you where you wanted to explore this side that you knew was important, but at least from my experience, I know that wasn't welcomed in my school.
Well, I didn't even know how to explore it. I just knew I had these ideas and perspectives on things, but no, like people didn't seem to be as interested in them. They wanted like straight medicine, which to them was physical, was that science, but the tangible science. And so if you got into like soft mushy things like mind and emotion, and this is where like everything was split centuries ago, like medicine took over body, so the physical, and then the mind went to psychology, psychiatry, and then the spirit went to religion. But those are artificial like separations. It's like the health really involves everything.
Mhm.
So yeah, it was hard to be in situations. I know that they would call me when I was in residency if something like in the emergency room was going down and there were parents that were super stressed or emotional.
Mhm.
Then they would be like, Arlene, you go talk to them. I'm like,
Yeah.
why me?
You're
I
the
don't know
compassionate one.
anything.
You're the empath.
They're like,
Yeah, you're the
yes, but
empath.
you're like nurturing. You're like motherly and nurturing. And I'm like,
Yeah.
yes, but nobody's taught me what to do. So I just laugh because I'm like, well, I just knew to be nice, just to be kind, right?
Yeah.
To try to understand where they're coming from. That's all. And at some point in residency, because of the stress of all the medical education, I felt like I was going to get sick if I didn't
Mhm.
do something to address my own health. And I was thinking that, and I was walking down the street and I looked up and I saw a yoga sign and I was like, I'll do yoga.
Why not?
And I had never done it before. So I started doing yoga and meditation. And so little things that had been really bothering me, like I had reflux that would keep me up at night and I would just, get stressed. It's always stressful in the hospital. So
Yeah.
it would be hard to like not be stressed. But then it became noticeable to people because somebody in the emergency room commented, one of the clerks was like, why are you all calm and everyone else is like running around? And I'm like, we're supposed to be running around, but I was doing it and like calmly. And another physician actually commented to you. She's like, there's something different about you. But it helped my digestion. It helped my mind. It helped me relax. It helped me in stressful situations. And that was in a matter of 3 weeks, I felt those changes.
Wow.
And so I was wondering, I was like, this stuff is, I mean, it's not like medicine prescriptions. It's like
Right.
anyone could go do it. I was like, why aren't we recommending this to our patients? But that was the state of training at that time. And it's not that they don't mean to be like that. It's just it wasn't training wasn't developed in a way to address the whole being. And it's because of that artificial separation into the different professions, I guess.
Mhm. Did you share any of that with your colleagues at the time? And what were their responses? Even something simple as yoga. Were you like, "Hey guys, this has really helped with my digestion, with this acid reflux I've been suffering from." Did you share any of that? Did you find that it was received well?
Um, I mean, at that point in time, most people weren't really interested in it. They did try, like in medical school, we had one nutrition class, meaning like one lecture, and we had like one um, experience in like mindfulness and meditation.
Mm,
And then people would just be giggling and laughing, which was totally fine because that's another way to like relax and release. But they didn't take it seriously in
right.
the way but it's curious because like if you looked at like evidence-based medicine, if you actually looked into it, you would see how much you could improve in health with meditation and yoga, from your
Yeah.
breathing, your blood pressure, your digestion, your cognition. I mean, it goes on and on. So we're not using all the tools that we can. We have so much more available to us than what we are recommending for patients. And so I've always looked at it, I was like, wow, we can really raise the bar of health. And I was always curious in those what they call outliers. So if you had a study and they
Mhm.
had a scattering of like results, I was always curious in the one that was like really far out. They did so well that it was like not anywhere close to the line, the average. And so in studies, the outliers skew the results. So they usually tend to like delete them as that's why they call them outliers, because they're like, well, that's like outside the norm. But I was like, no, I'm interested in what's outside the norm because they're doing like really well. And
Yeah.
why, if we studied what happened there, maybe we could recreate that or just figure out what are those aspects that are helping that person become an outlier.
Amazing.
And I mean, they're really just miracles. They call them outliers, but they're miracles, and miracles are just something you don't really understand. But if you understood them, then maybe we could make them happen more often.
Yes, I'm just so thankful for you and your just we need more people like you. We do because there can be there can be someone who goes through the same experience that you did in school and feel so pressured or so pushed in one direction that they aren't as confident to explore those outliers that you wanted to explore. And that has ultimately led you to how you practice now. And I'm just so thankful that you were confident in that and that you continue
Well,
to explore it.
confidence is relative because I was very quiet. I was much more shy. I was much less outspoken, and it's something that I've cultivated over the years,
Mm,
that I've learned to trust myself, learned to trust my intuition, learned to trust the common sense. Like, to me, what was obvious, but didn't seem obvious to other people, because
right.
the more that I took steps towards that, the easier things became in my life. And then the more efficient healing was, like for patients. Like, what if I just followed that kind of intuition? So using everything that you have available to you.
Right, absolutely. So, what exactly did you do your residency in? And then how did that lead? Did you go right into opening your own practice? Did you,
So
your path to lead you there?
I did my residency in pediatrics in the Bronx at Albert Einstein Jacobi, which was the year I left. The next year they moved it to a new building. So the building was like so old. And then there was something like in the literature called sick building syndrome, something like that.
Has no crazy
Sort
mold?
of how what you thought, like when you walked in the building, first of all, there was a McDonald's on the first floor.
Why wouldn't there
We
be?
we were in Super Size Me, that documentary. So and then and even the other residents, they would say, because we weren't they weren't necessarily like holistic, but they were like, there's just something about when you walk into the building, you just don't feel as good anymore. And so it was in like the environmental stuff, something called sick building syndrome. Anyway, I'm just joking because they moved it into a new building afterwards. So I was like, we got the bottom.
You got gypped.
Got bottom of environment and bottom of nutrition available for easy things in between classes. That's Doctors of America.
I was like, I guess if you feed them McDonald's, you're just promoting your own hospital. The cycle just,
Yeah.
I mean, everyone knew it was ridiculous, so it was nothing hidden there. But anyway, so then after that, I started. I found the term integrative medicine because I read Andrew Weil's book, Spontaneous Healing. And then I started searching integrative medicine. So thank goodness we had Google by then, because then I could find people. So I did a rotation in integrative medicine. And then after that, I did his 2-year fellowship in integrative medicine. So that really expanded things. It gave me like a nice overview of wow, there's so much more to medicine. I knew there was, and they were holding back on us. And then after that, I really loved to work with my hands, and I grew up with music, but I wondered why I never really used it as much later on. And when I started studying with the cranial osteopaths, that's when I was like, oh, this is what my whole life has led up to, because I'm like, I can feel the rhythms in the body. And so the body has like so many rhythms in it. And we know some of them, your heart rate, the electrical activity in your brain, your breathing rate. So, but all the tissues actually have their own rhythm, and they're all supposed to function together in resonance like an orchestra. So they need to be in tune and in rhythm with each other.
Yes.
And so that's something really beautiful about cranial osteopathy, to be able to feel that with your hands, feel all the different layers, the bone, the fascia, the movement of fluid. So when I describe it to people, I'll just say, well, I'll check the alignment of the bones, including in the head. I'll also check the movement of the fluids. So the arteries bring nutrients, the veins remove toxins, lymph flow drains inflammation, cerebrospinal fluid flows so the nerves can communicate well. How the organs feel and how they're communicating with each other. They need to be in tune and rhythm with each other, feel balanced and whole. And will also help to reset the nervous system, especially the autonomic nervous system, which I can talk about at length. But so what I will add to that, what I've expanded for the osteopathic profession is that I'll also feel the rhythm of the emotional body. And so that's something that I actually help teach other physicians to feel, so that they can incorporate it into their practice the way that I do in mine. And it really, there's so much I can say about that.
And for those who have never had it done, can you explain just very simply what it is? It's light manipulation, but in better words. For cranial osteopathy.
It's fully clothed, laying on the table. So we call it a treatment table, but it looks like a massage table, but it's fully clothed. And so I'll generally tell people, first I'll put my hands on your head, and then I'll come around the side, put my hands under your back, under your bottom, on your belly, shoulders, arms and legs as I need to. And I won't move a lot, but you might feel things. You might get some belly gurgling. So that's a vagus nerve release. You might get twitches. It's just nerve pathways opening up. You could get other sensations, other pathways opening up, or blood flow opening up. So, and you can also get like thoughts and emotions bubble up, because the tissues can hold on to things that are difficult for you to go through, to experience. So it can hold on to things, but as things release, you can get that bubble up, and you can talk to me anytime during the treatment. And sometimes I'll have people also do some mind body exercises to help their own treatment. So to treat themselves. So, and I'll incorporate all different kinds of things.
So that's the solution to the first patient 0 for Dr. Arlene. She's found her solution of how to unblock that trauma in the tissue and help that patient now. So discoverers at home, don't miss that, because she answered her own question. She took the journey to get there, but being on her table helps release that trauma bond in that physical and emotional state by what she does as
cranial osteopathy.
Yes, and to
Yeah, that
talk
was-
about that patient with pneumonia. So some people might think, well, what would that have to do with pneumonia? Well, if you have tension in your body, so anytime you have stress or trauma, the body curls in towards fetal position, then that can interfere with the movement of the fluids. So if you're talking about pneumonia, you need that lymphatic drainage. You need the lung to be nourished by the blood flow and the toxins removed by the venous flow, so drainage. So it does have something to do with pneumonia. And if you knew how to help open those pathways up, I mean, it's the emotional body. If you want to talk about just the fluid body, like the lymph flow, that's just blocked plumbing. But see, you're always a human being. So all those dimensions are integrated always. I mean, you can't ever tease it apart fully. So someone might say, well, is this like a mental thing or emotional thing, or is this like a physical thing? And like my answer is it's always everything. Sure, there might be like one layer or dimension calling out more than others. However, you cannot completely tease it all apart because you are a human being. And if you were to tease them apart, you would no longer be a human being.
Right.
you'd be human done.
I firmly believe that because my experience with you as a patient, or when my daughter was a patient, when Jada was born, so my last baby, she's, oh my gosh, almost 2. She'll be 2 in October. But when she was born, her sutures were overriding. And then in the next 3, 4 days, they did not kind of go back to where they should be. And I went to I don't see my own children. So I took her to somebody that I consider kind of another local holistic pediatrician. And she was like, you need to go to neurosurgery. And I was like, no, I am not going to do that. I will go see Dr. Dijamco. And I mean, I think that what you were saying is that Jada, when she was born, she didn't breathe on her own for almost 10 minutes. And the cord was attached. We had her at home. Her heart rate was always above 100, so we were comfortable. And that cord's there for a reason, but she just needed extra time. But that is traumatic. That is traumatic for her. It was traumatic for me. And I think her body was physically holding on to that. And her little sutures just weren't, going back to where they belong because of that trauma that she was holding at a cellular level. And I mean, we saw you once and they moved.
Oh, that's great.
And it just goes to show that the body holds on to so much physically that if we just work to calm the central nervous system, to open those channels, that we can heal so incredibly on our own if we're given the proper tools. So
Oh, I know.
yeah, I tell patients that story all the time. And I'm like, you guys just need to go. Just go see her, please.
Sounds like my orchestra needs a tune-up.
Yeah.
With all of my chronic stuff
Yes,
I've been carrying around
you
for so
do.
long.
So a question I have for you, I know that is a large part of your practice, but I know it's also not the only part. How do you is that a major modality for you when patients come to see you? Do you have different appointment types where you are integrating other modalities or supplements or anything like that? What does a typical day look like for you?
So a lot of the visit will be spent with the cranial osteopathic portion, but that is both informative. So it's assessment or diagnostic for me and therapeutic. So it's treatment at the same time, but it gives me so much information. And it can help me with just looking at what's needed in the diet or nutritionals, herbals, and supplements. I'll use flower essences, homeopathic remedies. I'll usually give people some kind of homework, but it'll be really pretty easy because I really feel like the small things done consistently can create miraculous results. So I'll give them homework that's hard to turn down.
Right.
Like
because it'll usually be something fun.
Simple things that they can be able to implement into their daily routine without feeling stressed out.
Yeah. Like because when I talk to like regular physicians, sometimes they say to me, well, we don't have time for this. We don't have time to talk to them about that. And I tell them some of the homework I give people. I'm like, it takes me maybe a couple minutes to give them their homework. So one story I tell often is of this grandmother, and she was taking care of 3 teenage boys. And so she was under a lot of stress, and she had chronic diverticulitis, had gone everywhere, was on chronic antibiotics, but they still couldn't keep it at bay. So she came to see me. And then, obviously she was under a lot of stress. So I just asked her, well, what do you do for yourself? What do you do for fun? And she's like, nothing. I don't have time. And I was like, okay, so all I want you to do is one thing for yourself every day. You can do whatever you want. 15 minutes, like lay on the couch, read a book, go for a walk, have lunch with a friend, call somebody. I don't care. You don't even have to have any other reason except for I want to do this. And so that was her number one homework. Of course, we tweaked the diet some and then got things moving, like with the cranial osteopathic treatment. But just with that, it just took like a few appointments. And then she learned how to address her own life. She learned how to read her life. So I told her, I was like, if it starts to flare, it's not a problem. Just look at it as a message. So when it flares, take a look at your life. Like, oh, did I eat something that I know will make it flare? Just tune that up a little bit. Or did I forget about myself again? Oh, okay. I know what to do. And she knew. So anytime it would start to flare, she would just tune it up and that's it. But the advice of do something yourself. I don't care what it is. Like that took me about 2 minutes to give.
Yeah.
So
the other day I wrote down on a patient's treatment plan, I actually wrote this down. Laugh. Find something to make you laugh, because she was so secluded. She didn't have a lot of interaction with people. She had no just social stimulation. She wasn't joyful. And I was like, we need to find something that just you enjoy, that makes you laugh, that makes your soul feel good and fulfilled. It's tiny little things that people don't realize how drastic of a difference it will make in how they feel. Yeah.
It's why we like to watch those videos of babies laughing or kittens and puppies.
Now, a word from our sponsor.
With a looming fluvid season upon us, prevention is key. Supporting your immune and gut health every day is crucial. That's why I trust Stellar Biotics for daily immune and gut health support. With 20 years of science behind their metabiotic and probiotics, Stellar Biotics produces all-natural supplements that are proven safe and effective for everyone in your family: children, nursing mothers, and even pets. I trust them for my family's immune and gut health support, and I hope you consider them for yours. Learn more at stellarbiotics.com and use coupon code DrCC10 to get 10% off your purchase today. So can we talk a little bit about how we can use something like cranial osteopathy to keep people well, whether that is newborns, children, adults? How do you view that as something, or do you view that as something that we can utilize or implement to keep patients well? And if so, how often would you like those patients to check in?
A wide variety depending on what people are coming in for. So if they are dealing with something, an issue, then I might see them more regularly, but it's not going to be as frequent maybe as some other therapies. So it could be once a month or so. Just with something with some regularity until things start to smooth out. If it's like sometimes people will bring in their families in just to kind of check in and see what's going on. I'll have plenty of people bring their kids in, or just want to, even the babies, just to see what happened. They might have gone to the pediatrician already, but they want to see what happened with the birth. I'll also, like for the kids, for anyone, I can feel their constitution, their personality. So it helps me to guide them with what to expect or how to handle things. And so for the little ones, then if they're just coming in for that kind of general checking in wellness, then I might give them some advice for parenting. Like, well, your kid is kind of like this. So just for you to know for future years, it might be best to address them in this way. Because there's so many different kinds of constitutions and personalities. And people that come to see me, maybe they prefer a more holistic way, or maybe they've gone around the block and just not seeing the progress that they want. So anytime someone's stuck, then I say, well, expand your perspective. Just pause and expand your perspective. So cranial osteopathy can be a way to expand your perspective. And I'm happy to collaborate with any other kinds of specialists.
Yeah.
In terms of like what people see me for, it can be all kinds of things, from any kind of inflammation, digestive issues, headaches, concussions. I guess if we're dealing with like head things, there's not as many types of practitioners that know how to treat the head or the vectors of pressure that you might get in the head from a concussion.
Right.
But it's all cranial osteopathy. The term is kind of a misnomer because it's not just the head. It's always the whole body. It's always the whole being.
Right.
And now, because I do so much like trauma release work, and we also teach like trauma release exercises in the office. And Brooke teaches here with me too. So we'll have those kinds of workshops about once a month or so. Because I talk a lot about the emotional body and stress and trauma and the impacts it has on health, then a lot of people will come seek me out for emotional trauma stuff. But they want to address that for their physical health too.
I actually had a really cool story the other day of it was a mom and a baby. And I think, I can't remember, don't quote me on the age, but it was under a month old. And they had actually seen, this is the one where they were like, oh, we just saw Dr. D. And I was like, Dijamco? And they're like, yes, that's her. And they were supposed to have a home birth, and it did not go as planned. And they got transferred to a hospital, ended up having baby in the hospital. And some things just happened after birth where the baby was put in the NICU for a little bit. And mom just felt disconnected from the baby because of the time separated, where they could only go visit, certain hours per day, etc. And they went to see you, and she said, you worked on the baby and you worked on her. And immediately after that, she intuitively felt more connected to her baby. And I know my heart was just, but it's amazing because it speaks volumes to what you do, and also the importance of what you do and how it can help heal traumas that we don't even know we
Yes.
have.
I mean, this is such a beautiful story.
Yeah.
And it's like such a regular story in my day. And I don't say that for me, I say that for everyone, so that you know that this can be the norm for
Yes.
health and connection, relationships, for life. That is more the norm, because nature always goes towards balance. So it's a part of us. It's already built in, but sometimes things kind of get stuck, and we've for various reasons. But that resilience is a built-in mechanism in everybody. So I love those stories. I love to hear them. And I mean, every day we have stories like that, because everyone is really so amazing and has like such a beautiful life experience. It's about being able to see it in that way. So even the hardships, there's something really beautiful going on. It's how they're growing through it, or it's what are those messages coming through, even through the symptoms and the issues. And so once you start to be able to look at it that way, then life starts to have a lot more meaning.
Yes, and the purpose behind it, because something for me very personally was when I was chronically ill for about 6 or 7 years, I developed a form of PTSD that every kind of symptom that would pop up, and just normal life. I'm a little tired today. Well, I also have 3 kids and work full time, but the initial kind of feeling of that was, "Oh my gosh, is this coming back? Do I have Lyme disease again?" And I had to work for a good year or two to change that perspective and to change how I view kind of that journey that I went through. And that is then physically when I started to feel my best, was when I was able to change that perspective mentally, and how that correlated with how I felt physically. I mean, it makes all the difference. And I tell patients this all the time, that no matter what's going on, no matter how many things we have going on, or, later on in our journey when our labs all look great to my, what I consider great, that we still can remain in a state where we don't feel like we're completely healed, because our body has not caught up. Where our body has to be on par with where our labs look and all these other things for us to physically feel better. And that's
That's
where
like,
modalities
yeah,
like yours are just so impactful.
that's where it's like integrating the
Yes.
whole being. It will help it feel so much more in resonance, because it's when there's some sort of dissonance. So like the mind, and it's so easy for, especially when people have they're great thinkers.
Mhm.
They can kind of think themselves out of things, like, I'm over that, and then the body can be over here and be like, I'm not.
Yeah.
And so it's like you got to like get on the same page. So that's a misalignment or like some dissonance there, and so that will present itself as some sort of symptom, and the symptom is like that sign or the message. The body's like, hey, remember me.
Right.
So bringing it together. But the more you can learn to understand yourself, the more you can hear and see yourself, then the more access you have to your own healing.
So what are your biggest, would you say, what are your biggest, if we're just talking about wellness, what are your biggest tips and tricks, whether for your own family, for your kiddos, and for you, but also tips that you offer to your patients who are wanting to stay well? What are your top few suggestions there?
One, to let yourself breathe.
Why?
So I can give you my 3-step process to get through anything. So it'll be like, I mean, it's really just letting yourself be.
Mm,
So it's one, you can start, if you're a thinker, you can start with that. What am I thinking, feeling? Um, if you're like more a physical feeler, then you can start with like, what am I feeling in the body, like physically? So what am I feeling emotionally? What am I feeling in my body? And then next, am I breathing? If not, then start breathing into those
Sherry told me
areas.
to breathe earlier today.
It's important. I mean, if you want to set, I mean, I set my personal record today for most days being alive in a row. Did you set yours?
I sure did. We're nailing it.
Good job. Keep doing it. Everyone, take a deep breath.
Every day, right?
Yeah.
Every day.
Keep breathing. I love that though, because it's so simple. And this is something I tell patients all the time, is we can take all the supplements we want in the world. We can take all of them. And a lot of the time that will not be enough because of our physical
Well, yes.
body.
And if the body's like this,
Yes.
the supplements can't get into the
Can't do
cell.
anything. And then what did you say? Then you just have expensive pee.
Yes.
But it's true. They have nowhere to go. So it's so important to incorporate
Well,
all
I
of
mean, I love it when I work with other practitioners, because they get to see how much more efficient their work becomes too. So whether it's a therapist or somebody else is managing all the supplements, or anyone else they're seeing, they will feel stuck too with the patient, because it's like, gosh, we're working so hard and we're not getting anywhere. So if you're working so hard, see, health is a natural process. It is nature. So if you're working really hard, you have to take a step back and look where the ease is again. And it might be another layer, but that could take some courage too, because to be able to see yourself, hear yourself, takes courage in the beginning. And especially if you're going through something difficult, or if you've had some trauma or some dark times, it's hard to see all of that, which is why our bodies are so helpful for us and help us cope by storing things away until a time where it feels that we can handle it. And so just to like cradle yourself like a baby through those things. You can't make the baby stop. You can't say, stop crying, baby. You have to just be,
embrace
be
the
okay.
baby. Yeah. Do you have any guidelines that you follow at home with raising your own kids as just tips for wellness? Yes, give them to us.
I have 4 kids, and you know how your kids are all different, so different personalities. So it's so the more you can see and hear yourself as a being, then the easier it will be to understand your kids. And your kids are, Dr. John Kim once said to me, like, your kids are great Zen masters, because they will trigger for you everything,
Yes.
everything that you're not yet over, you haven't yet processed. things that you had forgotten about in your childhood will now come to the surface at every age that they are, because they'll go through it, or they'll say something, or you'll hear your own words come back at you, and you'll have to deal with that.
Yes, it is so true. They are the most humbling